Hey, it's Phil LeFevre, Managing Director for ODG. And today we're going to take a closer look at the new LTD Predictor score from ODG by MCG, available inside your ODG for Disability interface. As many of you know, we've embraced two product tracks. There's an ODG for you, whether you're in workers' comp or ODG for disability. And the new LTD Predictor is designed to deliver through that web-based user interface and through an application programming interface, real-time scoring to identify those claims most likely to transition at end of benefit from short-term disability or STD to long-term disability or LTD, specifically geared for clinicians and disability claims handlers to help them triage, optimize, and facilitate return to work for short and long-term disability claims with reliable, consistent, evidence-based guidance, answering four key questions or content areas. First, disability duration or time away from work. Second, enhanced clinical content like questions around collaborating for recovery and social determinants of health. Third, impairment determination criteria to determine if and when claimants can return to the jobs, whether they have a medical diagnosis. That doesn't necessarily mean they can't work. And IDC will help you answer those questions. Our focus today will be the LTD predictor. What's driving that score? Well, some things that look familiar: primary diagnosis, comorbids and confounding factors, procedures like drugs and or surgeries, demographics, but also two other key introductory factors like plan design. For example, if I've got a 26-week plan or a 13-week plan or a 52-week plan, that's going to change the likelihood that I transition at end of benefit to LTD. And then what's today's date relative to the date first day absence? Those things play a role. How did we develop this tool? Well, as part of the acquisition by MCG, we now have access to a dedicated team of actuaries and data scientists at Milliman in our San Diego office. And they drilled down into STD and LTD data and actually married that data with commercial health plan data to understand what medical treatments and surgeries and procedures were done on the disability claim. In this graph here, this is one particular diagnosis, and these are what we call continuance tables that show the likelihood for various plan designs that a given case will transition at end of benefit. On the right-hand side is a 52-week plan, and over here on the left-hand side is just a 13-week plan. Each of these plans, of course, has a different probability because they have more runway or less runway from first day absent to end of benefit. Here in this white line, we draw an example. At the 13-week point for this particular diagnosis, which will remain nameless, you've got a 6% transition likelihood to LTD on a 52-week plan, but on a 26-week plan, it's much higher at 33%. And each of these, of course, track up to 100% as you reach that end of benefit date, with the probability on your y-axis and the number of weeks into your short-term disability down here on your x-axis. Of course, a 13-week plan at week 13 is at end of benefit, so the LTD predictor there is 100%. If we introduce confounding factors like obesity and substance abuse, you can see the LTD predictor jumped quite a bit from 33 to 42% on this 26-week plan. Even the 52-week plan had a 50% increase in the likelihood from 6 to 9%, as those confounding factors can play a big role in driving disability duration. Let's take a look at the example on the web-based user interface. I'll move to ODG by MCG, where I can search by medical topic, ICD, or CPT code, and I can go ahead and select one of these common conditions here, in this case, a back sprain. And now I've got my early predictor of long-term disability at 9.5%. I also have my disability duration guidance, my A, my average, and my B, my best practice, along with the timeline, videos and tools, case management guidance, including how to facilitate timely return to work and what questions to ask of physicians, as well as your impairment determination criteria and your social determinants of health. But again, our focus is on the LTD predictor, and I can refine any diagnosis right down to the claim level with this refined box here, where I can specify, let's say, the job type. Maybe I'm looking at a heavy job on this particular file. I can also identify key factors like the first date of absence. Let's say the first date of absence on this case was 3 months ago. We'll go back to June 21st instead of today's date of September 21st. That means we've already missed the return to work benchmark. And typical return to work on this file would be July 24th or 2 months ago. So that drives my LTD prediction way up to 56.9% from just about 9% previously. Again, because I've been out so long, I've missed the return to work. That number can and should be much higher at that point. What if I had confounding factors like diabetes, obesity, and hypertension? Well, those confounding factors may not change your physiological or your target return to work date, in this case, still 21 days, but it has pushed the average out and it's driven the LTD predictor score into the high category. That's a case where you're looking probably for complications. You need to engage a nurse disability case manager, specifically around those collaborating for recovery questions. Now, the end of benefit that it assumes here is a 26-week plan, the most common in the industry at December 20th. I can also change my end of benefit. So it will assume 26 weeks, the standard or most common plan in the industry. But let's say this is a 52-week plan. So I'm going to take this out to, by adding 6 months, out to June 2021 to the 19th. And now from a 60% LTD predictor, I'm back down to 27% because there's still a lot of runway left on this file. Big opportunity for me to deliver timely return to work. This, of course, again, is never before seen in the industry. The optimal return to work and LTD predictor score based on non-occupational disability alone. And that, of course, is strategic advantage to use that STD LTD data and then to marry it with the commercial health plan data so we understand the medical snapshot or diagnosis characteristics with respect to treatment and confounding factors and demographics. If you'd like to understand how this would look for your organization or configure an existing solution, find us on the web or give us a call. You can find us at mcg.com/ODG. And our phone number is 800-488-5548. Thanks. Bye-bye.